now that a week away we're going to have one of its own, an international medical camp on cardiovascular issues. An international medical camp organized by the Republic of Malawi and the United Republic of Tanzania, involving the Jakaya Kikwete Cardiac Institute and the Queen Elizabeth Hospital based in Blantyre. This international medical camp is the first initiative towards consolidating our health sector collaboration. As I've put it, it is in the great interest of both of our governments under His Excellency Lazarus Chakwera and Her Excellency Samia Suluhu Hassan, my president, to see that health challenges that we have the competences to address no longer be troubling our people in our two countries, Malawi and Tanzania. So now to go straight to the point, this press conference today, and I would like to urge our members of the media to convey this message to the greater Malawi population that from the 20th of this month, which is the 20th of March 2023, and a week-long period, we're going to have an international medical camp on cardiovascular issues. A medical camp that would focus on addressing issues related to heart conditions. And for that matter, we'll be working with the super specialized doctors from the Jakaya Kikwete Cardiac Institute, who are going to work hand in hand with the specialists from the Queen Elizabeth Hospital here in Malawi. So a medical camp is simply an organized event whereby super specialized doctors will be there, and they're from Tanzania and Malawi, and they will be there to listen to whoever that would come. To listen. This is number one at the medical camp, to listen. So whoever that wants to have their heart conditions checked, you should take this opportunity. It's free of charge. It has been paid for by the United Republic of Tanzanian government and the Republic of Malawi's government. It's free of charge. Come one, come all. The doctors would pay attention to listen to you. How are you feeling? Number two, they would do examinations. You know, the doctors, I am flanked by doctors here. They would have stethoscopes. They would test you. They would tell you your heart is beating right or is not beating right and what is the problem. But after the examination, they will do testing. And here they will do testing with very sophisticated equipment, including the echo machines, whereby they would really look into your heart and to see whether there are issues or whether they're not issues. After the testing, but also testing would lead to say you're perfectly fine, or testing would lead to diagnosis that you might have an issue that requires now a second level intervention. The fourth step that will be part and parcel of the camp now will be a treatment plan. A treatment plan might involve prescription of medication and you're well and you can go home and healthy. Or it might also require a big operation or a minimal, what they call invasive intervention, which is an operation that is done without opening the body. But all in all, these specialists from Tanzania and Malawi are there to make sure that your heart's health is our concern. So come one, come all. As you are aware, issues of the heart and heart conditions don't come out until it's very late. They don't come out until it's very late. I lost a father a number of years ago, but we came to realize my father had a heart condition when we've completely lost it. And you are aware that Tanzania lost a sitting president, the late John Pombe Joseph Magufuli, because of the same heart conditions. And interestingly enough, the Tanzanian government then had procured a technology that can treat issues of the electricity of the heart. But before it was, all set up he passed on. So we don't want that to happen to any other African. We don't want that to happen to any Malawian or any Tanzanian. So this international medical camp is coming to realize that your heart's health is our concern.
A specialized camp in Atlanta whereby you're going to be looking at people with heart problems in Malawi. We just wanted to hear from you why you decided to come up with this camp here in Malawi.
As I've said earlier, Tanzania and Malawi have a long-standing history of bilateral diplomatic relations, and we're even strengthening our bilateral cooperation by having sectoral collaboration. And I've mentioned a number of sectors that we are already engaging and having initiatives and activities around those sectors. And this time around, within the sector collaboration, the health sector collaboration, we're going to have the first international joint medical camp that specifically looks at the cardiovascular care. We do that because Tanzania and Malawi, African countries, are struggling to have healthy populations, and we believe working together, the synergy that we can bring would address the health challenges of our people. So starting with the cardiological issues, that is what pushed us. We want healthy Tanzanians and healthy Malawians, and particularly to the areas that we are most competent about, then we would want those competences and expertise to benefit the people of our two countries, and that is in line with the directives of our two heads of state, His Excellency Lazarus Chakwera, President of the Republic of Malawi, and Her Excellency Samia Suluhu Hassan, President of the United Republic of Tanzania, and my President.
How many experts are you sending from Tanzania to Malawi?
We are sending a total of 10 people. That includes about 6 or 7 super specialists. These are super specialists, people who are specialized with advanced cardiovascular care. There will be those that are dealing with, there will be surgeons, those that are dealing with open heart surgery. There will be those that are dealing with minimal invasive intervention. This is the operation of the heart without opening the body. There will be those ones that are specialized in pediatrics, the children, and many others. Plus, there will be the team will be accompanied by nurses and technicians.
I also understand that Malawi maybe lack some facilities and equipments maybe to handle issues to do with heart problems in Malawi. If such be the case, will Tanzanian government be able to take some of the people that will be found to be in need of such equipment to Tanzania for further help?
During the camp, there will be basic equipments, very sophisticated, like the echocardiogram. Yes, echocardiogram. Those ones will be brought from Tanzania to here, so people should be comfortable that the very sophisticated equipments for testing the heart, they are brought from Tanzania. But should we find people who are in need of emergency attention, that will be taken to the discussion between our two governments, and I am representing the United Republic of Tanzania, and would have a discussion with the Ministry of Health. And those that require emergency services, I am more than happy to have them referred to Jakaya Kikwete Cardiac Institute. The idea that Jakaya Kikwete is coming is also to complement to the efforts that Malawi is doing, but also to minimize costs that the Malawi government is incurring right now. Sending a patient to India or South Africa, comparing to sending a patient to Dar es Salaam, definitely Dar es Salaam will be a better choice for that matter, and we are looking forward to facilitating that.